talk about one of my favorite topics, senior citizen. My name is Ann Caulfield. I'm a veterinarian at Phoenixville Animal Hospital. And what we're going to do is just talk a little bit about, this was my little Temple, who was a rescue from a pretty horrible puppy mill. She had 2 broken front legs that they never fixed. And so she had to walk like this until we got them fixed. And she was a feisty little thing, but she was a sweetheart. So what we're going to do is talk about older pets and the role they play in our lives, and what are the things we can do to help them out as we face some of these changes that happen in their lives. And it is that changing status of pets in our lives where we like to say they've gone from the backyard to the bedroom in a relatively short period of time, and they become a really integral part of our lives. That was the client gave me that picture there. The Rottweiler in Philadelphia. That's kind of neat. So it's this changing status in our lives that's really driving these advancements in veterinary care that are allowing these pets to live the lifespans they are. Better nutrition, we're understanding more and more. We're not there yet. We don't know everything. It's like a human nutrition. Preventive medical care, doing screening and getting some early screening tests done, just physical exams, and more advanced diagnostics and treatments that are allowing very commonly cats to be 16, 17, 18. Not unusual to see them 20 these days. And our dogs, little guys, same thing, 16, 17. So they're living longer, definitely, and they're generally healthier. But as they age, there are some challenges that can be posed with their health care, keeping them happy and comfortable. So what I'd like to talk about today, can everybody hear me okay? Is, just a little bit, everybody wants to know what's the lifespan. They come in with a new dog they adopted, what's the lifespan? How long are they going to live? So, what is that lifespan? What are we talking about? And who is a senior pet? When do we consider? There's no hard definition of that, but in general we have some guidelines. We'll talk a little bit about what the aging process is and isn't. And then we'll hone in a little bit on some of the more specific health concerns that we probably see more commonly in our pets. And then finally, as they get near the end, some quality of life assessments. It's really, really difficult and it's really stressful, when you see them struggling to know, when is it time to kind of let them peacefully go. So there's some ways that we can try to look at that and assess that. Okay. So back to that lifespan. So it depends a little bit on a few things. What species you are. So lifespan of a little mouse, much, much different than the lifespan of this parrot. So you're looking at maybe, probably at most a year, probably months for a little wild mouse. Probably upwards of 60, 70, 80 years for a big parrot like that. So you definitely need to make plans if you get the parrot. Also the breed, so even, with our domestic dogs, our little Chihuahua friend here, wouldn't be unrealistic to think of that Chihuahua, having a lifespan of probably 16 or 17, but our big guy over here, we're probably looking at more like, fortunately, 6, 7, 8, so it really depends on the size. Acquired diseases, this is a big one. So weight gain, poor nutrition, arthritis, these things that kind of come along, sometimes even starting in early life, that can influence how long our dogs and cats are going to live. Environmental stressors. So you can imagine these feral cats that are kind of dependent on people feeding them, disease amongst them, fighting, their lifespan, just getting predation, getting hit by cars, they're not going to live as long as our cats that live inside nice and comfortably. American Animal Hospital Association suggests, when are our pets considered senior? And there's several definitions, but in general, when we consider them seniors when they've lived about 75% of their expected lifespan. For small breeds, that's going to be 11 years or older. For these medium to large breeds like your Labradors, maybe 9 to 10 years, and then for the giant breeds, like we say, those guys, you're looking at 6 or 7, considered senior pets or geriatric. Cats are a little bit more uniform. We don't see the big size variations that we do in all the dog breeds. So generally we'll start to see age-related changes, subtle things at about 7 to 10 years of age in our cats. We consider them seniors anywhere from 11 to 14, and then 15 and on up, we're considering them more geriatrics. And this is a really important point I want to get across as I get older. The aging process is not a disease. And I do hear this a lot, that, you know, a dog will come in and it's stiff or it's limping, and people say, oh, they're just getting older, you know, but the poor health is not synonymous with aging. And we do see, and we'll talk about this, obviously more disease processes happening as pets get older, but you know, in us and in them, we should not just assume that, you know, age is a disease process, or they should be unhealthy when they're older. But aging is associated with this gradual kind of deterioration in interrelationships among a lot of the body systems. And we'll talk a little bit about what we're seeing in our pets. So acquired diseases like cancers, and a reduced ability to really cope with physiological stresses and environmental stresses. So here we go again with our older cats living outside, or people have, you know, fortunately I don't see it as much anymore, but, you know, having your old dog living in the backyard in a doghouse, not going to be able to cope with that as well. It's very rare to see a geriatric pet come in with one single problem. So what we call comorbidities, or multiple disease processes going on, in multiple organ systems. So again, that degeneration and the interrelationship of how these organ systems are playing together as things sort of degenerate a little bit. So you get various levels of dysfunction depending on which systems are involved. Aging is genetically programmed, or it really appears to be, but there's so much, and this is true for ourselves, there's so much that we can do that can influence the aging process in our pets. So nutrition is a big one, exercise and fitness, and then trying to manage and prevent, if we can, or at least manage acquired diseases that come along. And our best way that we have of managing those types of diseases that we'll talk about is picking them up early. And it's really true in cats. Cats are just champions of hiding disease. They don't let us know they're sick until they're really sick. So one of the first things that we start to see in cats is their weight. They'll start to lose a little bit of weight. And it's really tough to pick up, you know, pet your cat or pick them up and say, oh, you've lost 2 ounces. But this is something that we see every day. You know, day after the cat comes in, 6 months later, it's a ½ pound lighter, and that's a big concern, unless we're actively trying to get it to lose weight. So really good, and they appear to get sick quickly, but it's been there, it's been smoldering until they hit that tipping point. They can't compensate anymore, and then it's like, wow, they just got sick so quickly. So picking up diseases, picking up problems early will really help us manage much better. And these are some of the systems, just briefly, that we see alterations in. So the endocrine system, all the glands, the thyroid gland in particular, pituitary, the adrenals, things like Cushing's disease and hyperthyroid disease or hypothyroidism in dogs. In their digestive tract, as they get older, they're not digesting fats and proteins maybe as well. A lot of oral cavity disease, a lot of dental disease in pets as they age. The integumentary system or the skin, a lot of times they'll have this dry, kind of thin hair coat. Your skin has lost some of its elasticity, so wounds and things like that can be more common, particularly if they're laying down a lot over pressure points like the hips and elbows. Cardiac disease, we definitely do see some structural changes in hearts and sometimes the blood vessels, particularly the valves of the heart in certain breeds, and we'll talk about that. Urinary system, kidney disease is a big one in cats as they get older. We'll talk about that. And then finally, musculoskeletal system. So arthritis is probably one of the most common diseases that we see, resulting in a lot of dysfunction, a lot of pain, and oftentimes leads to euthanasia. So the nervous system is another one where we can see deafness really commonly. Their visual acuity starts to slip as they get older. Taste and smell. Smell tends to hang in there pretty long, but definitely vision and hearing loss is very common. That's another one with the hearing that people, all of a sudden they just seem to get deaf, but it tends to be more progressive. Certain pitches, certain levels of sound sort of begin to drop out. That conversational level of noise they don't tend to hear as well, and it can be a problem. I can probably tell you about 5 or 6 dogs that people have run over in their own driveway because they're laying out there, they don't hear the car, they back over them, and it's tragic and it's really sad, but it happens a lot. So you want to be protecting them from getting themselves hurt. And also, they're sound asleep, they don't hear you, you come by to pet them and it startles them. Sometimes they'll nip or they'll snap, so good, stomp on the floor, or make some vibrations, maybe touch them with a pillow or something like that to wake them up. But it can, it happens to my own dog, he falls into a sleep boy. I gotta kind of look at him, make sure he's still breathing. Metabolism, so in general, their metabolic rate can slow down. They don't thermoregulate as well as they start to get older, so maybe skinny little cats and really are often chilly, and they're not as active. So just starting, we'll kind of hit on a few of those specifics. So if we start with the digestive system, and we're going to talk mostly about dental disease. This is not confined to older pets, but we tend to see it at its worst in the older pets. It really is preventable, or at least manageable. It is probably one of our most underdiagnosed sources of chronic pain in pets. There's a huge bacterial load associated with all that plaque and calculus that forms in the mouth, which causes chronic inflammation, and possibly bacterial seeding from the mouth. The bacteria doesn't just stay in the mouth. There's a big blood supply there, so every time we're chewing, we get a shower of bacteria. But mostly what we worry about with it is the pain and that chronic inflammatory state that's created. Tooth loss, it affects how they prehend or grab their food, how they chew, could lead to digestibility problems, and these teeth that are loose in there, when they bite down, it hurts. So it's very, very common, probably at least, maybe even more, 60% of senior pets do have pretty significant dental disease. And this is not unusual. You see lots of gum recession. I can't drive the pointer. But this is pus coming out with the teeth. That's hair. It's all caked around those teeth. And you can just imagine how that smells when they come up and when it gives you this. So So dental cleanings are a really important part of preventive health care. And I know it's a very common concern and a legitimate one that, they're so old, should we get these teeth done? We're really worried about anesthesia. And there is nobody that can tell you there's nothing to worry about with anesthesia. I don't care if that's us going under or these guys going under, but I will tell you that modern day veterinary anesthesia has gotten to be extremely safe. We use the same anesthetic drugs that are used in people. We do everything we can before they're put under anesthesia to make sure that that's safe. These are usually gas anesthetics, so if they notice a problem while they're asleep, their heart rates drop, blood pressure drops, we can wake them right up. So age is not necessarily going to be a reason to avoid doing the teeth, and I see this every day too, is the teeth are bad, but they're 13 years old, we're not going to do them. And they come back next year, they're 14 years old, the teeth are even that much worse, and it just keeps going and going. It really does get to a point where the health concerns associated with these bad teeth outweigh those anesthetic risks. But as long as they're monitored closely, they're a good surgical candidate. So we're dealing with all the potential disease processes that might put them at higher risk under anesthesia. The other good thing about, if we do more frequent cleanings or do home dental care, we'll talk about that, is, if we do have to do the cleaning, then they're not gonna be under as long. It's a quicker cleanup. You don't have to have them under for 3-4 hours pulling teeth and doing all that. So, talked about how do we make them a safer anesthetic candidate, pre-anesthetic blood work, we watch the blood pressures closely, they're on IV fluids. But home dental care, this is something that's really, really important. Cats too. Cats are tough, but it's still worth trying. I always tell people I'd rather see you take 5 or 6 months, try to teach them to maybe tolerate having their teeth cared for at home, than trying to get a toothbrush and you rush in there and they're throwing their heads all around, and it's really frustrating and it just won't get done often enough. Because you need to brush the teeth, ideally every day, but at least every other. If you're doing it less than every other, then we're not removing or at least minimizing that plaque layer frequently enough to prevent the bacteria from causing gingivitis and then that whole periodontal disease cascade. And it takes it that long to start setting up into that hard calculus that you've probably seen in their mouths that you can't brush away. But if you take your time, when they're calm and relaxed, maybe just start massaging the outside of their faces a little bit. Cats tend to like when you rub them there because they have that little cheek gland, just like that. They want to run away, look away, you let them go. It might take you 6 weeks to get them comfortable with that. And then the next step, you can get a pet toothpaste, which you don't technically need, but they're flavored so they like them. So you put a little dab on your fingertip and go under the lip and just do a quick little rub like that. Keep it where you keep their treats or their food. Get all excited when you bring it out so they sort of kind of look forward to it. And then eventually you can get maybe even just an old t-shirt or gauze or a thin dish towel wrapped around your fingertip, moisten it with the paste. And now when you rub the gums and teeth with that, it's soft, but it's still a little abrasive, so it's going to help to break up that plaque layer. And then, eventually you can try toothbrush. I just recommend trying like the smallest, softest kid's toothbrush that you can find. But it's the frequency, whether it's the cloth or the brush, it's going to make the difference. And you won't brush off what's there, but it will help it from getting worse. Some animals are just not going to let you do it, And if they can't, there's actually a website you can go to. It's called vohc.org, and that stands for Veterinary Oral Health Council. And what that is a group of academic veterinary dentists, board-certified clinical veterinary dentists that came together to test a lot of these dental care products that you can get. Because there's a lot of bogus information about and claims of what they do and don't do. And so they test these products independent of the company that makes them. And it's pretty rigorous. And if it passes their testing, it'll get this VOHC seal of approval. And they have a website, vohc.org, that you can go to that lists all these products that have passed their testing. And some of them are water additives, some are foods, some are treats, some are gels. So you might be able to find something if brushing doesn't work. Brushing's the best, but at least, something that would fit your particular pet if they're just not going to let you brush.
Question. In your experience, have you ever seen dental diets really work with cats?
Well, the thing with the dental diets, so the dental diets are specifically made to, it's how the kibble is constructed to have this scrubbing effect. So there's a difference between dry food and a specific dental diet. So a lot of cats, and some dogs for that matter, they don't tend to chew the dry food well. And if they're not going to chew it, it's really not going to really make any difference for them. But I have seen cats that do. I think it can make a difference, and it has been shown to make a difference. Okay. But not these cats that just kind of swallow it, and they're kind of big too, so the kibbles
are still swallowing.
Yeah. Jeez. Yeah. So nutrition is huge, and boy, this is a topic that there's lots of different opinions and lots of information on, and some of it's supported with research and a lot of it isn't. But I'm just going to make some general statements. The senior diets, for some pets they work well, but just because your pet hits a certain age and we might consider it senior, does not mean they necessarily need a senior diet. Senior diets in general have reduced the calories, they've also reduced the protein a bit, because they're assuming that they're not as active, they're also assuming that maybe their kidney function is not as good as what it was when they were younger. But that's not necessarily true, and in fact, some senior pets need that higher protein because they're losing muscle mass through that aging process. So, I tend to recommend, a good quality diet that your pet does well with, and honestly, that fits your budget. There's, some of these foods are $60, $70 a bag, so, and that, that keeps the coat nice, that keeps the stools normal, unless there's a medical reason, that we've got liver disease or kidney disease, where we may be actually looking at some of the prescription diets to help, then, they may not necessarily need a senior diet per se. They don't tend to digest fats and proteins as well as when they were younger, so that's where kind of blanketly saying the senior diets, may not be for everybody. The other thing I don't have in here too, but is in dogs, the grain-free diets, they're just starting to track some issues with those diets, and it's primarily cardiac. We're not sure, or the Department of Agriculture, I think is who's looking into this, that there's a statistical link between a certain type of cardiac disease and grain-free diets in dogs. And I'm not sure whether it's the lack of the grains or whether it's what they're substituting the grains with. So you can Google that, you can find out more information, but that's kind of an emerging kind of topic out there that you need to kind of be aware of, but didn't need to talk about it in this talk, but just to put it out there.
How did you get them to sit still?
I didn't. Somebody did. So we want the diet to kind of meet the individual's needs, deal with these comorbidities. So for kidney disease, allergies, inflammatory bowel disease, sometimes nutritional therapy is one of the main ways that we manage it, especially with kidney disease. Some of the research now is supporting that these early kidney diets, they used to just, everybody that had even minor evidence of kidney disease went on KD diet, or, which is ultra low protein. And the cats are obligate protein eaters, so they need relatively high levels of protein if they have kidney disease. So what's being done now is to start these cats on a modified protein. So we drop the phosphorus in the diet because that is important. Phosphorus, high levels of phosphorus will accelerate kidney damage. But they're trying to keep those protein levels, higher, not as high as a regular maintenance diet, but higher than what the traditional KD or those types of diets. So as the disease progresses and they get more end stage, then we have to lower that protein even more. But so that some of these diets really are showing good evidence that are helping these animals live longer. Enhanced palatability. So things that we can do to try to encourage our little seniors, if their appetites aren't really good, to get them eating, because that really is a prognostic indicator of how they're going to do. If they're losing weight, they're not eating, we've got a hard battle to fight with them. So you can warm it to body temperature, moisten the foods or canned foods. Canned foods tend to be, particularly cats, we're recommending those more and more. They don't have as many calories pound per pound as dry foods, so you need to eat a little bit more of it, because mostly what canned food, there's a lot of water in that. But for a lot of our little old senior kitty cats, we need them taking in that extra water. They do drink a lot, and a lot of people go, oh, they have plenty of water, they're drinking all the time. But the problem is their kidneys aren't concentrating the urine, so they're expelling a lot of really diluted urine, so they can't keep up with their normal hydration needs. So our easiest way to do that is to just kind of get them to eat more canned foods. You can add broths, low salt broths, to soften it if their teeth bother them, and that sometimes perks up their interest. Small frequent meals, sometimes they do better with that than like want their ability to get to their food and their water to be easy and easily accessible. So sometimes, you know, you've got an older cat and then you get a puppy and the puppy keeps getting into the cat food, so you put the cat food up on the dryer and the cat has to jump up there to eat. You know, they don't have any choice, they don't want to starve, but with arthritis or muscle tone, that's a really challenging thing for them to do. And sometimes they'll just decide, I'm gonna skip a meal. So they may not eat as well if they have to, you know, really go through a lot of gymnastics to get to their food. You might have to modify the bowls. You've got some neck pain in the dog, bring the bowl up a little bit, and make sure they're on good traction. You know, a lot of our houses now are tile or wood, and that's really tough on these older dogs that have arthritis. So making sure they're standing on a nice traction surface. We'll talk about that in a little bit. And I mentioned the body weight. I think with cats, having a little scale, just an inexpensive pet scale at home, is really a good thing to have because the weight is so important. Trends in either direction, you know, if they keep getting heavier and heavier, we want to know about that because it's often not a matter of when, if, it's a matter of when they become diabetic. But as they get older, we start to see usually that typical weight drop, which is usually a red flag that there's something going on and we need to kind of look into that. And it's very stressful to bring cats to the vet. So, you know, most vets are fine bringing them in and, you know, come on in and weigh them periodically. But I know it's stressful, so sometimes having either a used baby scale or an inexpensive pet scale at home where you can track what the weight's doing and then call if you notice a trend one way or the other, I think that's a really important thing. When they're older, and particularly we know they're battling things like thyroid disease or kidney disease, weigh them, you know, every few weeks, at least every 3 or 4 months. As I said, the progressive weight loss is often one of our first indicators that there's a problem before they're going to show up. Well, so a lot of people want to know, should I give them supplements? And it kind of depends. I mean, with arthritic dogs, we do use a lot of fish oils for the omega-3 fatty acids. Cats with kidney disease or chronic GI disease will use B vitamin supplements. The glucosamine, chondroitin sulfates, we kind of think of them, they're not going to hurt, they might help. So we tend to recommend them. Probiotics we're using more and more as more evidence comes out supporting that, you know, they may have a beneficial effect. And then in some diseases, antioxidants can be helpful. But what you want to try not to do is put all this stuff in there and create a food aversion. And this is, again, going back to our cats. You got to pick your battles with them. Sometimes if you just put something in there that they don't like, and they smell it or they taste it, and they walk away from it, next time you put that food down, even if it's not tainted, they're not going to eat it. So we got to be really careful with hiding things in food, especially like medications, because one, most medications don't taste so good, and two, we're not going to know if they're going to get the whole dose if they eat around it or it starts to dissolve, and we definitely don't want to make a food aversion happen. So the endocrine system, probably the most common thing that we see in our seniors with hyperthyroid disease is almost exclusively a disease in older cats. Dogs tend to get hypothyroid disease, not necessarily always when they're older, but it usually, almost always is a benign thyroid tumor. We don't know what causes it. We do occasionally have a malignant version of this disease, but it's usually benign. And very classic symptoms, usually they're losing weight even though they're eating normally, or oftentimes they're just hungry all the time, always hungry. They rip into cereal boxes, or, you know, whatever they can find when they're hungry. PUPD, polyuria, polydipsia, so they tend to drink a lot and they pee a lot. They do tend to be vomiters. Sometimes they, you know, because they have diarrhea. A lot of them are kind of restless. They walk around just yowling, vocalizing. Tends to be, you know, a high level suspicion when you see an older cat, lost a lot of weight, and you can palpate right down here where the thyroid is, and you feel this big goiter, this big thyroid mass. They often have really high heart rates. Sometimes they have a heart murmur. They don't tend to groom themselves as well, so their coats look they look very straggly. And a lot of them have high blood pressure with it too. So we run thyroid screening, we check what their thyroid levels are, and we generally will look at other things too, complete blood count, and chemistry in particular, because it's very common that your hyperthyroid cats also have kidney disease. And if we overcorrect or correct too aggressively the thyroid, we're gonna make the kidney disease a lot worse. So we have to be aware of everything. Remember what we said before, it's usually not one thing going on in these little seniors. So we're kind of balancing, keeping all these plates spinning. We look at the urine because a lot of times they've got, the older cats get urinary tract infections, not so commonly when they're young, but as they get older, we see urinary tract infections. And then, blood pressure measurement, because kidney disease and thyroid tends to predispose them to hypertension, which will make kidney disease worse. We don't usually diagnose with ultrasound, but if we're worried that it may be more of a malignant type of a tumor there, we can ultrasound it. It's treated in a variety of ways. Probably the most common, at least when we start off treating these cats, is with a drug called methimazole. And what it doesn't do anything for the tumor, but it inhibits the production of more of this thyroid hormone. So the tumor keeps growing, and this is sort of the downside to this kind of therapy. The tumor keeps growing, and a lot of these cats over time, they need higher and higher doses, and it becomes less effective. But it's probably the most common way that it's managed. Radioiodine therapy is sort of the gold standard if it's the right cat, where they give them an injection of a radiated compound. It only goes to the abnormal thyroid tissue. It doesn't do anything to normal tissue, and it destroys it. And for the vast majority of those cats, that's it. That's curative. There are a few. A friend of mine, I was like, you gotta get this done. It's the best way to treat it. And of course, her cat was one that needed another round of the treatment. But usually it's curative. Which do you pick? Well, it depends, I think, a little bit on the age. So if you've got a 17 or 18-year-old cat that was diagnosed with hyperthyroid disease, radioiodine therapy is going to run you probably a few thousand to have that done. So probably not a candidate for that. If there's kidney disease, once we correct it with the radioiodine therapy, we have to be, we can't take that back. So at least with the medications, we can adjust the dose a little bit. And a lot of times what we do is we start them on the drug and see how their kidneys tolerate bringing the thyroid down before we consider whether or not radioiodine therapy is the way to go.
What's that say?
What was the link from iodine therapy to kidney disease?
So it's not so much the therapy, it's the disease itself. So a lot of these cats, they also have concurrent kidney disease, and so these kidneys are a little bit dependent on that, maybe higher blood pressures, filtration rate to kind of keep them healthy, working as well as they can. And when we bring all that down after we correct the thyroid, we can push that kidney failure further along more quickly. Surgery can be done. I think it used to be done years ago more commonly than it is now, because those cats are either going to be on the medications or they're going to have the radioactive treatment. There is a diet. I really don't know too many people that use it. YD diet. It's a very low iodine diet, so you have to be careful if you have a multi-cat household. You don't want your non-thyroid cats eating it. It's okay. I would say that's the last resort to try to treat this disease with diet therapy. All the therapies, there's risks and benefits, to each. But the way you kind of sit down and make that decision, talking with your vet, you look at the age and what are we finding on our physical, and what are the comorbidities. So we already mentioned, probably at 17, you're not going to go for radioiodine therapy. We may just manage them on the medications. If they've got concurrent kidney disease, depending on what stage they're at, probably not going to go for something like iodine therapy, and cost. So if you've got a 12-year-old cat that's diagnosed with this, spending a little more upfront with the radioactive treatment might be in your best interest, because you conceivably have a cat that can live to be 16 or 17 that you're getting blood work on every 6 months, you're paying for the cost of the medication. So in a youngish cat that's diagnosed with the disease, I think it's definitely probably more cost effective to do the radiation therapy. And it's a one single injection of this compound. They're in the hospital for a few days just till the radiation levels die down, but they're just kind of boarding. They're not constantly being treated. I think I put here the living arrangement. Mostly that has to do with using a YD diet, but also medications. You know, if the only way you can get the medication is you put it in the food, and everybody's eating out of the same bowl, that may not be a good arrangement. And the temperament of the cat as well. Can you medicate this cat every day? Fortunately, with the methimazole, it's one of the few drugs that we know is absorbed across the skin or transdermally, so you can get a little gel that you rub in the ear. That works pretty well in most cats, but sometimes they don't want to let you do that, so lots of considerations there. Little angel. So heart disease. Mitral valve disease is by far the most common type of heart disease that we see in dogs. Very common in older, small breed to medium breed dogs. The Cavalier, King Charles, Chihuahua, Poodle, especially the calves, are really predisposed to it, and they get it much, much younger. That's my little Percy, and he was much, much younger. The snowball stuck all over him. So there are 4 valves in the heart that control blood flow depending on the cycle of the heartbeat. The mitral valve is one, it's on the left side. And what happens, we don't understand why, but these leaflets, they thicken. It's a slowly progressive disease, and then they don't close properly, so they become leaky. And when the heart beats, blood kind of squirts in a direction that it shouldn't. And that abnormal blood flow is what creates the murmur that we hear, and over time leads to enlargement of the heart. And eventually, we're not talking about weeks, we're talking about years, leads to heart failure. And early on, really for years, these dogs have no symptoms. We might pick up a heart murmur, as they start to come in after they've had it, for a couple of years. As it worsens, we're looking more that the heart is not working efficiently. They might be intolerant to exercise. You start to get really advanced thing called cardiac cachexia, so you start losing weight. You'll hear a cough in dogs. Cats don't cough so much with heart disease. That's more like respiratory, the asthma, those kinds of things with cats. But they don't tend to cough when they have their versions of their heart diseases. And then any kind of persistent increased respiratory rate. And then when we're really, really getting serious, they get that bluish look, the cyanotic mucous membranes, and then finally they can collapse. But that's really end stage. So on an X-ray with moderately advanced heart disease, we'll see the heart is enlarged and it pushes up. It's causing the trachea, instead of coming straight in, it kind of pushes the trachea up. And that often can irritate the airways and it can trigger a cough. So it's not necessarily heart failure in the beginning that causes a cough. And the treatment really depends on the stage. So when if we hear a murmur, we'll often talk about getting a baseline echo at some point so we know what's going on with this little heart. Many times, if it's early in the course of the disease, the cardiologists don't recommend doing anything. Maybe check it again in a year or 6 months, depending on what stage it's at. Nutritional support, probably more important in those dogs that have more advanced disease that we're trying to get them to eat because they don't feel well. But you probably don't want a really high sodium diet for them. That's why low salt broths and things like that will be helpful. A whole variety of medications that can be used. Pimobendan is becoming kind of a star of managing these diseases, and they're always arguing back and forth, cardiologists, when to start it in these dogs. So it's I think in general they're starting to start it earlier than instead of waiting until their diseases progress more, because it definitely has been shown to prolong the lives of these dogs. Cough suppressants, if they're just chronically coughing. And everybody wants to know, is there supplements that can help? And most of the cardiologists I talk to say, no, not really. There's nothing that's been shown to help with this degenerative process that just keeps going on with these valves. I had one that said, yeah, well, sometimes I put them on CoQ10. My little Cavalier has it. I have them on it. I don't know if it helps. It doesn't hurt, so I kind of put that in there. And then just regular monitoring. That might be an echo once or twice a year in the early stages or early to mid stages. doing a chest x-ray, definitely getting their hearts listened to, and if you notice anything, they're starting to cough more, or exercise intolerant, or the resting breathing rate is increasing, then, it's definitely worth getting them checked out. Kidney disease, big problem in cats as they get older. We do see it in dogs, but we see it much more commonly in cats. And again, we don't know why. There's lots of theories as to why all these little cats are going into kidney failure as they age. But it, again, like the mitral valve disease, it's chronic and progressive. It's not going to happen in a week or two. It happens over months and years, and that's why it's so hard, it's so insidious in a cat that it's not going to show us anything to know, should we do blood work now, what's going on. So that weight, checking that weight is important. There's different stages of kidney disease depending on, where their blood pressures are, protein loss, all different parameters that we use to stage it. But what we as pet owners will notice usually early on is they start to drink more. And then they pee more, so even if you're like, well, I don't know, I never see them drink, you just kind of think, well, look, I'm scooping out bigger clumps of urine out of the box, or I'm having to empty the box more. That might be a little indicator, maybe they are drinking more than what they normally did. And again, the reason for that is that one of the first things that goes is the kidney's ability to concentrate the urine. So they're drinking a lot, they're peeing out a lot of this really large amounts of dilute urine because they've lost that concentrating ability. So it's really tough for them as the disease progresses to drink enough to stay hydrated. So they always walk around, kind of subclinically dehydrated, and that can lead to a lot of these other problems like constipation. You have an older cat that comes in constipated, almost always has kidney disease or something else going on that's making them subclinically dehydrated. So keeping them hydrated is super important, and that's where the canned foods tend to come in if they'll eat it. Even adding a tiny bit of water or broth, you make it too soupy, especially too quickly, they're not going to eat it. Just remember, you also have to account for the calories, because by adding a lot of liquids in there, you're going to dilute your calories, and canned food isn't as high in calories as dry food. They might just be more finicky. When people say, oh, they're just finicky. I guess I see this more in dogs, where they only want a certain dog food, and then they only want treats, and then they only want table food, and then they only want a certain kind before. So a lot of times they don't just acutely stop eating unless it's more of a catastrophic acute kidney failure. They just get more picky about what they want to eat. And you have like 5 different brands of dog food in there, and then you end up buying chicken. It's like going to McDonald's and getting chicken McNuggets for this dog food. But as it progresses, no matter what species you're talking about, their appetites just get worse and worse. They get weaker, they lose tremendous amounts of weight, they get more lethargic. Vomiting is a big sign with more mid to end stage kidney failure. They can even get these really painful ulcers in their mouth, and breath is really bad. Dehydration is a big thing with battling. So you can feel, particularly when they've lost a lot of weight, you can feel these small little kidneys. And they kind of look like thyroid cats. They tend to be thin. They don't groom themselves well because they don't feel well. They're often dehydrated, halitosis, or that breath we talked about. And a lot of times they're constipated. A lot of times they do have thyroid disease on top of it. So, we start with the basics. We need to kind of get a broad look at what's going on there so we can narrow it down. So we do this baseline blood work, a complete blood count. Kidney disease, as it gets more progressive, we'll see anemias with that, so that's why it's important to look at a complete blood count, which tells us about white cells and red blood cells and all of that, and the ratios. The chemistry profile is what really gives you a look at what do those kidney values look like, what do the liver values look like. The thyroid level is often included in that. The senior profile is a T4, urinalysis, and oftentimes urine culture, as I said before. Urinary tract infections in younger cats are really not that common. All these little male cats that start peeing blood or straining to urinate, put them on antibiotics and they got better, and we're like, oh, they got a bacterial infection. Well, they would have probably gotten better if we had done nothing, because this sterile cystitis has a natural waxing and waning, and it's very strongly linked with stress. And Ohio State is doing a lot of research on that. But as they get older, we definitely do start to see more true kidney infections. So we often will talk about if we see suspicious evidence in the urine to run a culture, because if you've had a kidney infection, that's one of the few things that we can do that might help preserve directly that kidney function. It's kind of hit or miss though, because we can't get a culture right out of the kidney where the infection might be. We're getting urine from the bladder. So our hope is that if we grow something out of the urine we collect from the bladder, it will represent what could be going on in the kidney. We always like to get a baseline on their blood pressures, because with kidney disease, just like in people, a lot of times they have high blood pressure, and that's going to make the kidney disease worse. And then you can do x-rays, or ultrasound is even better, because the ultrasound can really actually look inside those kidneys. It's non-invasive and not a sleep for it. You shave their belly, but it really can give us a good feel of not only what the kidneys look like, but everything else in that belly. And treatment is managing all of the things that happen. Kidneys have such a major role. They're responsible for controlling blood pressure, for stimulating production of red blood cells, eliminating toxins, concentrating the urine. The list goes on and on. So as you start to have decline in function, you start to see all these little things start to, the wheels fall off. So you're trying to manage and monitor for all those things. So the anemias, the high blood pressure, azotemia, you may have heard that word, where these kidney toxins are actually building up in the bloodstream, hyperphosphatemia, all these potassium levels drop. So these blood panels are really helpful to us to help guide treatment for these old cats and dogs too. We want to know if they've got hyperthyroid disease and how we're going to manage that. Keeping them eating is hugely important. And like I was saying before, we've kind of gone away, unless they're really advanced in the disease, to putting on these ultra-low protein diets. So we do these early renal diets now that really help keep that protein going, to help them maintain muscle, but they're lower in phosphorus than the normal cat foods that you would buy. So we do try to use, in this case, the prescription diet, but I will say the most important thing is that they eat. If they're not going to eat these diets, they're not going to eat it. They need to eat something. So having them on, lower phosphorus canned foods. There's some of the over-the-counter canned foods, like the pate styles, that tend to be a little bit lower in phosphorus. Certainly the carbs too, and then like the chunks and things like that. But the most important thing is that they eat. And we like the canned foods because of that extra water intake. And if they're not going to eat it, you got to give them what they want. And then small frequent meals for these guys too. They often don't feel like eating a bunch at one time. Because this disease affects cats very commonly, and we mentioned before, cats and medications never go together very well. We really have to pick and choose what's the most important thing to get into them. So that might be an appetite stimulant, at least initially, till we get them eating again. Getting them on some phosphate binders if their phosphorus levels are high. Anti-nausea medications. So you kind of pick and choose from these depending on how sick they are and what you're going to be able to give to your cat every day without it, hating and running from you, because that you don't want to disrupt that bond that you have. I would say that once they hit a certain stage of kidney disease, fluid support is huge, and usually that means we've gone beyond the step where just giving them extra fluid in their diet is helpful. We need to actually give them these subcutaneous fluids, and you've probably had cats that you've had to do this with. I'm sure some of you have. And I'd say not all of them, but most of them tolerate it pretty darn well. And what we're doing is we're delivering, and it's kind of blurry, but we're delivering a bolus of fluids. We take advantage of the fact they have a big subcutaneous pocket, so you can lift their skin up, put a little needle in there, and get nice and comfortable. And then we deliver, usually, depending on if they have any heart disease or whatever, anywhere from 50 to 100 milliliters of fluids. Early on, that might be once a week, but as it progresses, sometimes it ends up being every day. They're all individuals. Now what this really does, for the most part, it keeps them hydrated. And that keeps them feeling good, and that keeps them eating. So that's the main reason that we often will go to those fluids. And I've seen cats live for years. kidney disease on these little fluids, a couple times a week. It eventually catches up with them, but it can really make a big, big difference for them. Adjunctive treatments like acupuncture and massage, I think acupuncture sometimes for nausea can be helpful in some cats and dogs that have kidney disease. Massage, again, just kind of a well-being thing. They don't feel well, they kind of sit around, they're not moving around a lot, so their muscles get tight, and a lot of times they don't have really good muscle mass, so they're more prone to muscle soreness. Herbs, we don't know a lot. I'm very open to, hearing and learning more about that. Cats we have to be, all animals, but in cats we have to be really careful because they're so different than most other species in how they tolerate and how they metabolize drugs and things that we give them. And so many things that you or I or a dog would take is toxic to a cat, so you always have to be really careful. But I know some veterinarians that do mostly alternative medicine really feel that having their cats on some of these herbal supplements like Romania, things like that, do seem to think it makes a difference. Make sure you got those warm, comfortable beds around. Try to maintain their life as close as you can to what it was before they became sick. A nice quiet environment. Like I was saying, easy access to get to their food and their water and their litter boxes. You don't want to have this skinny little sick cat have to go down a flight of dark stairs to get to their litter box in the middle of the night. Otherwise, they might just start peeing on your carpet. And keeping them mentally engaged and stimulated. Allow them to get, access to where they love to be up in the windows. They love to be up high, but maybe they can't jump up there anymore. So it's really going to be beneficial to keep their mental health happy, I guess, to give maybe little stairs to get down there. I've kind of jumped now to arthritis because that's osteoarthritis. That's a huge one that we see a lot. And I think a lot of people are surprised to know that maybe a 2-year-old dog that has a cruciate injury, and we feel the knee, and we can say, I bet he's already got arthritis now. Like, how can they have arthritis? They're only 2 years old. So it really is more a reflection of joint instability, osteoarthritis. We won't talk about rheumatoid arthritis. So you've got a cruciate, an ACL tear, or partial tear, and you're a 1.5-year-old Labrador running around. You've got this knee that's just grinding back and forth. You're going to have arthritis at 2. But most pets we see come in toward the latter stage of their life with more advanced arthritis. So probably the most common cause of chronic pain in our dogs and cats. We used to never think cats got arthritis because vets weren't smart enough to know how to look for it. But now we know that they get it very commonly and they get it early in life. And like everything, they hide it really well. So most people aren't walking their cats, so they don't see them limping. It's very subtle signs, like I don't see them up in the windowsill as much as I used to. Or they jump up on their chair, but it takes them maybe 2 or 3 attempts to do it, whereas before they used to just jump right up. It's those kind of things that you have to watch for in the cats. They're not as obvious in dogs. It's a progressive disease. We can't stop it, but we definitely can manage it. And this is one of those diseases that if we can intervene early, we stand a much better chance at helping them live more comfortably and mitigating some of the things that happen.
Oh gosh, the laptop's shutting down.
What does that mean?
There will be a 2-minute pause.
Anybody have any questions?
Yeah, good idea.
Or any stories about their own little seniors?
We have 2 15-year-old and 4-month-old Siberian Husky sisters that used to be they're retired sled dogs. We have 6 dogs we had, and
And that, for that breed, that's amazing.
well,
We've had them live
We
17.
had one 17.
Wow. Are they related?
Yeah, they're sisters.
There
The
you
ones
go.
we have now, they're
Yeah,
litter
so
mates.
there's that genetic.
And we have then one of their 2 sons, 2 sons, and they're going to be 13. And we just unfortunately lost a 13-and-a-half-year-old male. He got away at my cabin in Tioga County, got into a porcupine and blinded him.
It was horrible, yeah.
Yeah, and he couldn't
Yes,
find his
he's
way
loved to
home,
run
and we
away,
found
I
him
tell you.
passed along a stream, and she spent 16 days looking for him. She stayed at camp looking for him.
Oh my God, that's
Yeah.
so
We
hard.
couldn't, yeah. it
At
was-
least we have closure, you know.
Yeah.
But somebody had mentioned, I was telling, when we were going up to the mountains this past weekend to get my dog's ashes, cause he was
Yeah.
finally found. Our one dog that we were just talking about, when we got up there, she was having a hard time getting up and
Late.
and until then, she was chasing the 2-year-old that we adopted around the yard.
Mhm.
You know, she was a little mentally like slow, but
Yeah.
physically she
We're
was
gonna
doing
talk
fine.
about that too.
And so we took her in, and somebody today had mentioned this drug, GABAPEN.
Gabapentin.
Yeah, pen.
Yeah, and said that might be good, because she is a little shaky. You know,
Yeah.
she's
So
on
they gave her,
some
we took her to
medication.
the vet upstate, and the vet we put her on subcutaneous because she was dehydrated. I thought she might have been dehydrated from the ride up, because she seemed a little, now the dog has traveled with us all over the country. The dog ran a race in Drummond Island, Michigan as a lead,
Wow.
you know, several years ago for friends of ours.
Uh-huh.
So she's a well-seasoned traveler, but she seemed to get stressed
Yeah.
that trip, and she was drooling a lot, and I immediately, like, she's dehydrated, let's get water in her.
Mhm.
She didn't do much better the next morning, so let's take her into the vet, the local, and we did subcutaneous, you know, rehydrated, and some other, and they figured, ran all blood work and everything on her, and she seemed that we couldn't find anything really wrong with her. And she seemed to come back, they put her on a light antibiotic, because she might have had a urinary tract infection. She's doing better, but now she said we're having a little incontinence issues with her getting up and stuff, you know, because of her age, and we've got to kind of help her up.
Yeah.
You know, so she had heard about this
Mhm.
medication. Is this for joint pain?
So gabapentin is, it's being used more and more, I think, in the veterinary world. And it's basically a drug that it's not a pain drug per se, but it helps in certain situations of pain. So chronic pain is a big one, and what we call neuropathic pain. Pain directly related to like nerve injury, spinal cord injury. The reason that we use it in chronic pain is that what we know now about living with chronic pain, and this isn't whether you're a person or a horse or whoever, is that your nervous system undergoes anatomical changes with chronic pain. And you grow more of these pain nerve endings, and they're also they're what we call hypersensitive. So it doesn't take, this is why, you know, people would go pet their dog that had hip dysplasia, and they try to snap or bite and go, well, they're just being whimsical. They're not. That non-painful stimulus truly triggers a pain reaction in what we call this wind-up state. And once those nerve changes happen, it can be really hard to back that down, and that's where gabapentin seems to really help these dogs.
Does it help in backing it down or preventing it?
Preventing the
Further progression?
Progression.
Okay,
Yeah, it's a
or
good
backing it up
question.
from where it is?
Yeah, it probably does not help undo the damage that's been
Sorry.
done, but what we're trying to do is
Prevent
ratchet it
further.
back down and maybe make it less severe. Probably won't stop it, but make it less severe. There's a huge dose range on it. Pretty much the limiting factor on how high you can go tends to be how sedate they get, assuming there's everything else is help, you know, the kidney, liver, and all that, because it can be a bit sedating. It also has a bit of an anti-anxiety effect, particularly in cats. So we use it a lot in cats coming in. By itself, though, I would say if this is really osteoarthritic pain, I don't think it's gonna by itself do what you need it to
Yeah.
do. It needs to be combined. It works best in combination
We
with.
give her glucosamine, we've been giving her for several years. And she has had, well, that's what retired her, she tore her ACL
Yeah.
from running, you know. It was, I mean, we ran her, but it was recreational, you know. We're not far from professional dog sledders, but for fun and recreation and give, you know, and she's had the ACL repairs. And she was doing wonderful. She's running around the yard chasing the
I
2-year-old.
wonder if she did something, because they can do damage to the iliopsoas, like this muscle tendon.
She's
high
not
up
favoring
in-
anything, and that's why I thought, because we travel, they're crated when they travel. I have a rolling dog kennel with, each dog gets a crate, small, to keep them from moving around. And I thought maybe she, hit the brakes or a bump or something, she bumped herself.
Could also have some spinal, she's got like progressive, they get this lumbosacral disease, which is a kind of impingement on the spinal cord, the lower part of the back, and they'll get weak in the back and they'll be painful. So, yeah, it's probably not something that's gonna hurt, the gabapentin, but I think by itself, you may need, do you want, I have my laptop, is that?
Do you?
Yeah.
Okay.
I gave gabapentin to a raccoon with having seizures.
Oh, did you? Yeah, it
Yeah,
can be
that's
used for
what it's for.
seniors, yeah, exactly. We don't, it's not our first drug that we go to in dogs and cats with seizures, but in people it can be used, and
Okay.
sometimes in,
Yeah.
not.
Somebody
Is your
had,
dog also grieving?
she seems like she has a little doggy dementia because she's kind of old, but, yeah,
She was physically better than her sister. Mentally, her sister's better than her. But her sister was also a mother, had litter puppies, which we had. We had kept 3 of the 7 in the 1 litter.
yeah. Yeah, I know they definitely felt the loss.
Oh, yeah.
Yeah.
We have
Especially if you're
lots
big
of senior
like that.
dogs.
Yeah.
But, yeah, so gabapentin, I think massage, we'll talk about a little bit more.
Yeah, somebody had just, I was taking a HTML class today, and somebody had mentioned it, and she said, oh, my dog was on this, and it helped it, because the back legs
Yeah.
weren't, were shaky or something
Our
like that.
non-steroidal anti-inflammatory drugs often are our best tool to get that inflammatory pain down.
Yeah, I don't even know if she's
Have
in
their-
pain, I mean, she's in.
That's the thing too, honestly, I assume they are until
Yeah.
I can prove they're not, because a breed like that is gonna, it's gonna kind of pull through. Some of these dogs, literally that leg could be dangling by a tendon and they're still running with the tennis ball and chasing squirrels and they don't vocalize. That's the thing, a really big point I wanna get across is people come in and say, they're not in pain because they're not crying. They don't vocalize with chronic pain. If you stepped on their foot by mistake, you'll hear a yipe or, that kind of thing. But they're not like us. They don't complain, they don't whine. When they're living with just that kind of chronic, everyday, achy pain. They just change how they get around, how they do things. I'm like, ready to go up here. Do you want to get this going? Not very good.
You got PowerPoint on here?
Oh, that was the other thing. Oh, you know what,
It's in the top and it might go to,
Actually, it's
2000, I just,
Here?
yeah, that's what PowerPoint.
Actually, hang on. Is it one of these? Yes, it's one of these.
It's down a little modified.
Right.
There.
Okay.
So with 5 senior dogs and 10 and above, I just want you to know that we are very active supporting the veterinarians in Chester County.
I can imagine.
And Tioga County, where our
Yeah.
camp is.
Yeah, well, bless your heart,
You must have a good financial planner.
No, not right now, I'm looking.
No, I'm gonna be moving in with the dogs soon.
Interview next week, I know you'll get it. Like, please.
We all work so that our pets can have better
Yeah,
lives,
that's right.
right?
That's why I say mine, they let me pay the mortgage.
Yeah.
Yeah.
They pretty much run the show.
Are you familiar with pet plan insurance? Pet plan insurance?
Pet plan, not, I've heard of that.
Yeah.
But
I
I
was-
do.
I almost got into that company, I was like hoping and praying for that.
Yeah.
They offered free pet insurance, that's why they didn't hire her, they saw how many
Yeah.
she had.
Well,
Like,
they're
now we
broke
can't
hiring you,
afford that.
yeah.
Well, don't feel too bad.
But the
That's
owners
good.
have King Charles.
Oh, there you
Yeah,
go. Yeah,
they're
that's
from
probably why they
Australia.
started it.
Yeah.
Okay.
All right.
Yeah, we got that for free when I adopted my cat, and it's better than nothing, but I heard there are other companies that.
They're
Or better.
becoming a little more competitive because there's, you know, there's definitely a need, and I do think pet insurance is a good idea at this point.
Yeah.
It's cheaper when they're younger. Be really careful of what they cover, what they don't cover. But I do think it helps, you know. We can do so much now. We, you know, they do renal transplant at Penn. You know, one of the few facilities in the world that school at Penn is doing kidney transplants in these chronic kidney failure cats. We can give them new hips, we can do brain surgery, but, you know, most dogs, cats that I see every day aren't gonna need that, but it's the, you know, my puppy just got into the trash or just ate a bunch of mulch and now it's vomiting for 2 days and we need to do x-rays or blood work, you know, that's 300 or whatever, it's gonna be right there, that's where I see it kinda helps
Well,
solution.
Sienna, the one that we're talking about, she had both.
Never.
They had ACL done, I think they were
Oh,
$2,000 each
yeah,
or
yeah.
2,500 each.
Yeah,
So I put 5 into
$6
that.
million knees, I know.
Yeah, she was not a cheap dog.
So, we mentioned it's generally progressive but manageable if it's diagnosed early especially. What you're gonna see is kind of a lameness or stiffness, and it might be intermittent. And it's a lot of times is when they first get out, they kind of look a little stiff, but then they warm out of it. That's a kind of a hallmark of an arthritis lameness. What happens as you move around, you get this synovial fluid, this lubricating fluid moving over your joint surface. The PTs will tell people motion is lotion for your joints, and that's why, you know, we'll talk about how we manage it, but the right kind of activity and exercise is important. But, you know, as they become more painful, they may become, you know, less active. They hurt, they don't want to move, the less they move, the more they hurt. It's this vicious cycle. They can get irritable. We talked about that wind-up syndrome where, petting them, they're not being wimpy. You truly are triggering a pain response by touching them or using, or, you know, some kind of stimulus that shouldn't be painful, but really does, because now the nervous system has just gone haywire. They can eat less or they can eat more if they're painful. It's how they kind of cope with it. Cats in particular are not going to be grooming themselves as well if their backs hurt. They tend to get a lot of arthritis in the spine, the hips, the elbows. And in cats and to some extent dogs, if it's too painful or uncomfortable for them to get up and get themselves out or to get into the box, this is a really good point with cats. You know, the litter boxes we use, a lot of times we use what we think we want to have versus what's best for the cat. And so best boxes for cats are as big as you can get them. With the arthritic cats, you may need to get lower sides. Be creative. You can use a sweater box, or for my old cat, I got one of those drip pans you put under a washing machine. It has a lip like that. It took up like the whole, it was big, but she could get in and out of that really easily. But it also, you know, if they get in these smaller boxes, and the way if they have back pain, posture to defecate or to urinate, that can be uncomfortable for them. So they often will go maybe next to the box or somewhere else where it doesn't hurt as much, or just to climb in and out of it, or climb down the stairs or back up the stairs. So easy access, make it a box that's easy for them to get in and out of. So how do we diagnose it? Well, on a physical exam, you're feeling all these joints, you're feeling all the muscles and tendons around there, because oftentimes you have arthritis, but then you get secondary soft tissue injuries like us. You know, if you've got bad knees, it doesn't take long for your back to hurt because you walk differently. Your whole biomechanics of movement is thrown off, and you put strain on muscle groups that weren't meant to take that, or tendons that weren't meant to take that, so then you get all that other pain. You can feel these joints are often thickened. Crepitance is that, like, it feels like what Rice Krispie sounds like. That's what we're follow that. Their range of motion, you know, they're just limited. with either pain or with contracture of the soft tissues around there because they haven't been moving their joints normally. They'll come in with these skinny little back legs because they haven't been using the legs normally. They're off weight. They're trying to put more weight on the front legs, so sometimes the elbows go out. Dogs take about 60% of their weight on the front legs, but these guys are doing more than that because they're trying to get off the back. And it's not usually equal. They might be, having it off the right back leg and toward the front. With cruciate disease, almost always, not always, but almost, there's a bilateral disease in dogs, unlike in people. So both of their knees, they don't know where to put their weight. So we talk about x-rays, sometimes joint tabs, but that's more if we're worried about like a rheumatoid arthritis or an infection. Weight management is a multimodal therapy for arthritis. There's no one thing you're gonna do that's gonna give them their best management of this disease. If they're carrying extra weight, and you said, oh, I'm only gonna do one thing to help my dog or cat with arthritis, then get the weight off them. That's the biggest thing. The extra weight, we used to think that excess fat tissue is just a mechanical load, and that's part of it on these joints. But now we know that this tissue secretes some really potent, nasty inflammatory mediators that degrade the cartilage. And that probably is even more of a factor with arthritis than the mechanical load on the joint. So if we can get that weight down, then we're really gonna help them be much more comfortable and slow the progression. Pain management is huge, and I never like to come across like we're pushing drugs, but if we can't get them out of the cycle of them hurting and they don't wanna move, they're gonna hurt more, they're gonna lose more muscle, they're gonna get weaker, then we're really doing them a disservice. And we also have to think about their quality of life. So judicious use of these pain meds, I do definitely factor that in for many of these dogs, at least initially. If we can get them where we can do it as needed, that's the goal. But some of them are at a point where they do need something every day, and it's a combination. If we can combine a few different types of pain drugs that work at different levels of the spinal cord to influence that pain messaging going up and down the spinal cord, then we're gonna do better. We're gonna be able to use lower doses than if we picked one drug and tried to manage it that way. Supplements, glucosamine, chondroitin sulfates, again, there's people that really seem to think or feel that their joints are better on them, and then there's probably just as many that don't notice a big difference. And I think we see the same one in our pets, but because they're so safe, we do recommend them. I think the trick is, the supplement industry in this country isn't well regulated, so you definitely want to try to look for something from a company that hopefully would have some independent testing. Nutramax is a pretty reputable company. They have a lot of joint supplements that they offer. Fish oils may have an anti-inflammatory effect, so by reducing some of these inflammatory mediators, maybe we can slow down progression of arthritis. The curcumins, like in turmeric, there's more and more studies on that. The problem is the doses are pretty high. We don't even have like an official dose of how much to give, but in people it tends to be fairly high. And it can cause some stomach upset. So we tend to rely on, on the other more conventional supplements. Adequan, I'll mention, we often lump it into the supplement category, but it actually is an FDA-approved drug. So it means it has some more rigorous investigation than some of the oral supplements. And it's an injection, and it's not into the joint. It's just given like we give a vaccine twice a week for about 4 weeks. And then we do it either as needed or once a week, once a month, depending on how advanced. It works better if we get them before they're too far gone with your arthritis. And we really like it in cats because it's not officially approved for use in cats, but it's very commonly used in cats. Of a lot of drugs that we use, the companies don't pay to have the research done in cats. So but it's generally tolerated really well, pretty safe, so.
Question on the medications, NSAIDs, would be.
That's the non-steroidal anti-inflammatory drugs, so that's like your Rimadyl, your Deramax, your Novox, Carbocox.
I was wondering, like for a dog over the counter, anything, now they used to recommend aspirin, but I think aspirin doesn't, what the vets explained is aspirin doesn't play well with any of the other things they want to use. So
Absolutely.
now, because we gave her a low dose, 88 milligram aspirin, but I had only given her one in the morning, and it was in the afternoon. But they said that the aspirin's okay, but if you're going to bring it in for the dog in for other things,
Yeah.
don't, because it doesn't play well, and eventually it's not good
Definitely.
long term for stomach.
Yeah. that's
But other
true.
than Remedil, is there anything? I mean, Remedil's a prescription. Everything's prescription. Is there anything over the counter?
Not so much as far as drugs go. I mean, you have to be really careful with, the ibuprofen type. I
Yeah.
definitely would not do that. Tylenol's gonna kill a cat, one Tylenol. So I definitely would talk to your vet before you do anything. The thing with aspirin, we used to give it because we didn't have anything better, but they've come out with these prescription drugs that tend to be safer as far as the GI tract and the kidneys go. But that whole NSAID class of drug, there is a potential risk. That's why we like to look at blood work before, if there's certain other drugs they're taking, you have to be really careful. And it's true, if they're on the aspirin, then you gotta do this washout where you have to wait, a week or 10 days before we can introduce anything else that might be more effective and safer. And they did a study where they had dogs on low-dose aspirin, I think it was like for 3 days, and they went in and did a scope of their stomachs, and they saw these tiny, what we call petechial hemorrhages, tiny little pinpoint hemorrhages, all in the lining of the stomach. They weren't showing any signs of GI irritation or ulcerations or anything like that, but we were starting to see those little stomach irritations, hemorrhages in there, even with just short term. They just don't tend to tolerate the non-selective anti-inflammatories like we can. But as far as over-the-counter medication-wise, there's probably not so much anything else.
Everyone, all the vets I've spoke to recommend the
Yeah.
Remedil. In fact, our one vet said, next time you have a dog, she said, I'll actually put a refill on it if you have an older dog who's, maybe
Yeah.
running in the yard, comes in, it's a little sore. She said, you'd be better doing that than an aspirin, like a
I
Remedil
tend to
from
agree with
another
that.
prescription. She said, once I give it to you, I can't tell you where to give it, but that would be
Right.
better than giving them aspirin,
Right,
is
as
what she
needed. I
said.
wish that weren't true, because I know these drugs are expensive, and, and to do it the right way, you really wanna look at blood work before you start it, and then monitor it, a couple weeks after, and then if they're doing okay, once or twice a year.
We're not talking
but
about long term, we're talking about
as
one
needed.
time,
Yeah. But they definitely are safer, and the last thing that, we wanna do is cause any harm, so.
Right.
So ice, you can do ice. That's kind of a good thing. You don't think about ice so much with chronic arthritis, but if they have an acute flare-up, put ice on there. They don't like it that much, but, put a t-shirt or a thin towel and then your bag of peas, or you can make your own ice packs. You get a Ziploc bag, put 50% water, 50% rubbing alcohol, and stick it in the freezer. And it really won't freeze. It'll get kind of slushy, and it's very cold. So you can use that for 15 minutes or a few times a day for a few days with an acute flare-up. And then heat, that particularly is helpful with the muscle pain they get, and muscle tightness and soreness because they're moving differently, or as secondary injuries. And just like in people, stem cell therapy and platelet-rich plasma, PRP, you're hearing more and more about it, and there's some people that swear by it, and there's others that say, look, it helped a little bit, or it didn't help at all. I think the jury's still out, but I think it's promising that there may be some, I don't know if anybody's had any stem cell or PRP in their dogs. Exercise is really important, like we were saying, but it's gotta be the right kind of exercise. And everything they love to do is probably the worst thing they should do. So picture that squirrel chase at high velocity, they take off, they run, they stop, they pivot. That's really tough on these joints. So leash walking is your best bet. If they haven't been really exercising much, you start with short distances and gradually work your way up as you see how they do. It's gonna vary, that they may do great for a week and then one day they're really sore. And you kind of monitor that night or the next day, because on the walk, sometimes you don't see it. And then you just, tweak it. If they look like a little sore that day or they did something extra, then you back down a little bit, but you get them up and move them a little bit. Regular and controlled. So running around in the yard, most dogs when they're out in the yard exercising, they don't might chase a squirrel, they walk over here and sniff, or they roll in the grass, but they're not doing kind of therapeutic walking, like you can control in the leash. And I just throughout this time of year, be really careful with the heat. They cannot cool themselves with these humid days. They're very prone to heat injury and heat stroke. So err on the side of caution and keep them inside real early in the morning. So exercise helps keep their muscles strong. All these muscles around the joint are like shock absorbers, so that helps them be more comfortable. That synovial fluid's moving, so it keeps them, the joints lubricated. And it's good for them. They get out and they can sniff and they can, do what dogs do. So mental stimulation. You just don't want the weekend warrior syndrome there. There are different ways, swimming is really good if they like to swim. If they get stressed, then it's not a good thing to do. If you have access to a safe place, clean water where they can swim, then working out is very energy demanding, so you have to start slowly. But that can be a really good way to exercise because there's no impact on the joints. Leash walking, little exercises, this dog's walking over little cavaletti rails to help work on joint flexibility and strength and proprioception where his legs are. And then it's still important, even if they can't walk far, is to get them out and let them try to, be the dog that they were. So maybe you push them in the cart and get them out, let them walk around a little bit, and you put them back in, so you still can engage with them and have that time together. Adjunctive treatments, so acupuncture, some dogs really respond well to it. It's not going to fix the arthritis, but it helps with pain perception. Massage, I really love that. I think that's really helpful for all these dogs, and they like it. Cold laser, it's different than a cutting laser, but for some dogs, they seem to do okay with that. Shockwave, you don't hear as too much about that, but some studies show it can be helpful. Kind of painful, so massage is really, we like giving it, what studies have shown when you pet your dog or massage your dog, your stress hormones drop too, as does theirs. So it's a win-win. And you don't have to be a massage therapist, you just, start lightly, you don't want to hurt them, but you can definitely help with complications because they're moving so differently. Shoulders get really tight. If they've got hind end problems, they get spasms like we do, little trigger points. The home environment is really critical. So they live their whole life getting on the bed, and now they can't. That's really stressful and frustrating for them. So we give them a safe way to get on and off the bed by little pet stairs. Be careful that as soon as this dog comes down, it's going to wipe out on this hard floor. So you've got to watch that. Keeping them, safe in the car so they're not bouncing all over the place because that's not, it's not safe. Plus they hurt themselves in there. Traction is really important in our homes today because a lot of us don't have a lot of carpeting. Go to Five Below, get a bunch of cheap yoga mats. I have them all over my house, and they're easy to take up if you get embarrassed and people come over. And you can throw them in the wash, hang them out in the line to dry, and they give them traction. They're going to not work as hard with them walking. They don't have to use as much muscle strength. Even standing there to eat, it takes more strength to hold themselves in that standing posture than walking. So when you see these legs start to go like this, if they can be on something that's traction, they're not going to have to overuse their muscles. And that's why also dogs with hip problems, when they have a bowel movement, they keep walking because they don't have the muscle strength to hold themselves in that posture. So yoga mats work well. Some of the booties, there are these things called paws. They're like little balloons almost that fit on the feet, and they stay on pretty well, but you just gotta watch them. You can't leave them on long because they're kind of tight, but they can provide some traction, and on a slippery surface. Talked about the litter box thing, modifying that, feeding station. So this is what you don't want to do. This poor little thing, you don't want it to have to jump up on the counter to eat. So try to figure out a way to keep the dog out of the cat food area. They even make the indoor little collar things you can wear that the cat can get in, but the dog can't. So whatever it takes, but don't make it jump up on top of the counter or the dryer. Therapeutic bedding, you'll spend like $150 on a bed and they'll lay right next to it.
Or you buy them a heating pad, put it in the dog
Yeah.
box for the old ones, and the 2-year-old rips it up the same afternoon before they even get to use it.
Mobility aids can be really helpful, and I know we're all kind of like, we're not gonna do the carts, we're not doing the carts, it's for paralyzed dogs, but I think of carts as a walker, just like we would use a walker. So this dog has not lost full function of his back legs, but it's really hard, he struggles to keep himself up in a normal walking position. So the cart helps him do that, and he can walk much further where he doesn't have to support his whole weight, and he's in a more normal biomechanical position to walk than if he didn't have a cart. So carts aren't only for dogs, the little dachshunds that have lost function in their back legs, they can really be helpful. And then this help 'em up harness, I love this thing. You can get them online. I tend not to go with knockoffs of it. There might be some good ones out there, but it's worth the investment. They can wear it all day long. You don't want to leave it on 24/7, but it's like little suitcase handles. If you see them struggling to get up, you just bend down and just help them right up, help them into the car. If you're walking on a slippery surface, you can steady them. If they're a shorter dog or you're really tall, you can get either a scarf or something like that, loop it through the handle and hold it upright. And I don't know what these things are, but I got them at Home Depot. They're like these vinyl straps with like a swivel hook on the end. I don't know if anybody does. And because a lot of times they're walking and your wrists are going like this. So you can clip the swivel hook on there and that just spins around. And you've got this nice strong strap. But yeah, help them up harness. They're really, I never recommended it to anybody that's come back and said anything, but thank God we have this now, especially the big dogs. We're almost done. So the neurological system, I think probably the most common thing outside of brain tumors and things like that is this idiopathic vestibular disease, where usually a few times a month we'll get a call. My dog had a stroke, and they can have strokes, but this would be much more likely. What happened? They wake up and their heads are tilted, they're circling, or they're falling down, their eyes are going this stagnant back and forth, and for the most part, we don't know what triggers this acute onset vestibular disease in dogs, but it's pretty common in older dogs. Cats get it a little bit younger age, but it comes on quickly. They're really uncoordinated. Oftentimes they're nauseated because their world is kind of spinning around, so they can be vomiting, they don't want to eat. They don't really have any other abnormal neurological signs, and that's going to be your key differentiating factor between, is this a stroke, is this a brain tumor, or is this just old dog vestibular disease? Are they seizuring? Are they showing us any other weakness in the limbs? Because they don't have any of those. They just are, their heads are spinning, their eyes are moving. So there's no vestibular test, well, you look in the ears because you can have sometimes really bad ear disease that causes it, but these dogs usually don't have that. So you do your physical exam. Typical is, how old are they? Okay, well, it's a 12-year-old lab and he was normal yesterday and now he's doing this. And that's pretty classic for this. But you do always, want to make sure you're considering these other things, your inner ear disease, brain tumor, any kind of neurological infectious disease or trauma. And so we tend to fall back on our basics just to make sure that we're able to tell you that we don't miss something. But most of these dogs don't go and get a spinal tap unless it's looking less like this vestibular. And it's really supportive care. There's nothing that we can do that is going to take it away. Most of them resolve on their own, sometimes within a day or two, sometimes over several weeks. Sometimes they're left with a little bit of a head tilt, but most of them do tend to get better on their own. We just have to control their nausea, keep them eating, keep them drinking. If they're not, then we support them with fluids, nutritional support if they're so queasy they're not eating, helping them to get up and walk, definitely not on the slippery floors, keep them from falling and hurting themselves.
Would they treat that with a steroid?
It's not, some people do put them on steroids.
Because that's what I think we put Sienna on, to to get her to eat and, you know, kind of,
Yeah.
because they ran all the blood work, urine,
Yeah.
and
Yeah,
everything
it's
was
normal.
fine.
Yeah.
And it happened, you know,
I don't
and within
think
hours she couldn't walk.
there's no study that says steroids is always gonna help, but I know a lot of people do put them on steroids, because they're also thinking, well, maybe there's something else going on, so they're trying to cover for a lot of different things, but most of these dogs, even without any kind of therapy like that, tend to get better on their own. So senility, we call it cognitive dysfunction, but it's a form of dementia in dogs, relatively common. It's a neurodegenerative disease that we see, and it has very similar to early stages of Alzheimer's. In fact, the dog is a model for early Alzheimer's in people, a research model. And we see, you know, the beta amyloid plaques, the loss of neurotransmitters, and free radical production, which we will see with people too. How do we, you know, what do we do when we're trying to assess whether our patients have this dementia or senility? There's lots of different scales that you can use with this DISHA. Are they disoriented? You know, they go out and they forget how to come back in the door, or they standing in the corner. There's social interactions, either they become more aloof or they're just more clingy. Their sleep-wake cycles are different. Maybe they're up all night and they sleep all day long. They may lose their house training, and their activity patterns might change. A lot of them, they sometimes don't seem to recognize their owners or other pets they're familiar with, or even places they're at. They were saying they might become more anxious and more clingy. Develop separation anxiety, we can see it in these little guys, but that's its own entity too. We see that pretty commonly. And they just don't groom themselves and care for themselves. Maybe irritable, agitated, they might cry. You're always thinking, okay, this looks like it could be dementia, but we want to make sure we're not missing something else. So we do all those other things to check, the physical exam, the blood work, screening, you know, blood pressure, just making sure that, you know, we're confident when we come up with that diagnosis for you and says, this is what we're pretty sure is going on. Since there's no quick, you know, we take a blood sample and say, okay, yes, this is the diagnosis, so we're ruling everything else out. Most of it is what you, as the owner, notice.
Is this more disorder, like with humans, where it's a disorder of exclusion, where you have to rule everything else out and whatever's
A lot of
left
things
is
are like
this?
that. That's one of these.
So there's no real, while they're still alive, there's no real way to
It's
tell about
based
the
on-
beta amyloid changes or anything else.
Right, there's no blood test, there's no MRI scan, you know, those are all to rule out. Just like an epileptic, a dog that starts with a seizure, there's no epilepsy test, it's a diagnosis of exclusion. So we talk about blood tests and MRIs and everything to tell, so we can tell you there's no brain tumor. But that's the only way we can diagnose it. And the signalment, meaning, you know, is it an older dog or an older cat with these signs? And that puts that higher up than a 5-year-old that starts to do some of this, kind of get a feel. So it's what, you know, what people are noticing at home. This always sticks in my mind, this woman came to me, she said, I think, you know, my dog's not sleeping as well. And I said, well, how do you know that? And she said, well, he just doesn't dream as much. And so she just was really tuned in to her dog's, you know, sleep cycles and how he used to sleep and go into these dreams. So treatment, again, like a lot of these senior pet disorders and diseases, because they don't usually just have one thing, we're trying to manage them, we'll keep all the plates spinning, so we're managing the kidney disease or the thyroid disease, the arthritis, that's gonna keep them from being able to be up and be mentally engaged. Urinary tract infections that might make them feel sick. Arthritis that's gonna make them irritable and painful. The big thing with this specifically is making sure that you have a predictable daily routine for them, but it's stimulating for them. You don't want to do quick changes in their environment, if you can avoid it. You know, don't change like their environment around too much if you can avoid it. The right kind of exercise, and really being clever and thinking of ways that we can mentally challenge them and teach them new things. That has been shown to be the best way to kind of stave off these changes, is to keep them mentally engaged. So you can buy these little puzzle toys, little puzzle feeders for them. You can make them for smaller dogs or cats, and even like a muffin tin where you put some of their kibble and put tennis balls, and they have to figure out which ones to get. I think, keeping it somewhat controlled, but getting them out, maybe to walk a different street where there's new smells they can take in, those kinds of things. Again, just different ways, and providing them the ability to come out and be social like they used to be, even if they can't walk as far enough. So there is a drug that is FDA approved to treat, to help manage this in dogs, not so much in cats. But it does seem to help many, not all of them. It works better if you get it before they're too far gone. Usually takes several months to kind of kick in. We don't know how it works, but it does seem to help. The thing with it, though, the studies show that it works best with the mental stimulation. We can't just give them a pill and it works. You've got to keep them puzzle solving and doing crossword puzzles and all that. So if they're really anxious, then, and they're not resting and they're keeping everybody up at night, or sometimes we will use anti-anxiety medications. And then these pheromone therapies feel away, dog appeasing pheromone, those are certainly not going to hurt anything and might help. These are synthetic versions of pheromones that dogs and cats release that tend to have a calming effect on them. Soloquin is an L-theanine derivative in green tea, tends to have a calming effect. I think massage, go back to that again, would be helpful. Hills has a diet called BD, which is like loaded with antioxidants and free radical scavengers. And one time I was at a conference, I was talking to the rep, she goes, I want to start eating this myself. It was actually studied in people, the ingredients was studied in people with early dementia. But I think the bottom point is key. They have to have that environmental stimulation and enrichment.
We took a dog once with a younger dog who was just not very well behaved as an adopted dog, but it was easier to take them both to school, and she did so much better. Like, she was already very well trained at the start, but we couldn't tell if she was getting lazy or forgetful, but once she went back to like some positive, simple training.
Yeah, it really makes a big difference. So we're kind of, winding down to everything none of us want to have to face or deal with, but it's an elusive concept, what is this quality of life thing? And nobody has an answer that's going to be true in every situation. They have developed a lot of different scales to try to, more subjectively or more objectively assess quality of life. This HHM scale that really assesses, you kind of look at, are they hurt, hungry, are they still eating, are they able to maintain hydration, or are we able to help them with that? Or are they happy, are they engaged in doing things that made them happy? They may not be able to go chase a tennis ball anymore, but do they still have are they still interacting and seem content? Can they get up and move themselves around? Are they still mobile? And count these good days versus bad days. I think that's a really easy thing to do, even if you just make a little hatch mark. And when you see those bad days beginning to outnumber the good days for them, then, I think it's time that we need to have the conversations about, peacefully letting them pass on. There's other, you never want to have to make a decision about like life and death based on other than what's best for the pet, but the reality of it is that often comes into play. Can you physically lift this 150-pound, mastiff to get it outside, get it down the stairs, to provide that care, work schedules, time commitments, and, financially, it can become quite costly, and it's really emotionally devastating to have to make those decisions based on other than what's best for the pet. We talk about money and things like that and work schedule, but that's the reality of it. This hospice idea, concept was started several years ago by Dr. Villalobos, who's an internal medicine specialist in California, I think. And it's modeled after the human hospice movement. And it's really taken a look at these end-stage life in animals, a whole new way to look at it. And it's really a supportive approach and a team approach with you as a pet parent and the pet and the veterinary healthcare team, coming up and trying to decide what is the best decision to make. The pet caregiver support groups, I think, are fabulous, and we know that we know the loss that we feel when we lose a pet. That has been shown in studies. It's just what we're feeling when we lose a family member. And I could have retired 20 years ago if I had a dime for every time people said this didn't hurt this much when my parent died. It's very real. You have to know that it's very real. These animals take on the role of children a lot of times in the household, and it can be devastating. Day by Day is a relatively local group that does a really good job of just, kind of helping, and not just pets that are passing or have passed, but people that are caregiving a diabetic cat or a kidney failure cat. It can be wearing, just like caring for a family member that's got chronic disease. You can't go on vacation. You can't find somebody to watch the cat that can give it fluids, so they're very good in that kind of support. The Metropolitan has, Vet Associates has a bereavement group that meets, as does Penn. I hope Veterinary Pearl, I'm not sure. I'll just kind of leave it at that, because I think that kind of sums it up nicely. We're all that, we always just do it over and over again, and we always will. I'm really glad that you guys were here, and hopefully it helps, to give you some insight.
Thank you.
Long enough to break his heart.
Big goofball. He was a young Irish Wolfhound that had bilateral elbow surgery, and owners came in. He was sound asleep. I always look out to see if anybody's honest.
I just had a question. We also have a Siberian Husky, a 14-year-old female. And so she moves around pretty well. And slipping on the floors, but with a hardwood bed, then I've been putting down some carpet so it's easier for her. But as soon as I open the door to the bright sunlight, she starts twitching. And will lose her balance. And not like she's having a seizure, but doing this twitching. And it just is when that bright sunlight hits her.
Does she squint? I'm wondering if she's got, she's got the blue eyes.
The blue eyes, yeah.
She
So
should get her
cataract.
eyes checked out. She could be having some retinal issues or some pain with the bright light that's kind of thrown out.
When that calls the twitching of her legs and stumbling a bit.
It is hard to say,
Yeah,
make a case
right.
for, oh, my eyes hurt, now I'm gonna twitch. I think because you notice it with the bright light,
Mhm.
I think that would be a place to start, unless it throws off her, maybe she's like temporarily light blinded, she doesn't see
Oh,
as
that
well,
could-
maybe
yeah.
that's what's affecting her.
Mhm.
But I would start there, and also remember that it may not be one thing.
Right.
It could be multiple things, but at least make sure her eyes there's nothing going on with that light.
Gotcha.
Well, she's coming up on her year, like you said.
Mhm.
Yeah, yeah.
Blue eyes are worse in the sunlight.
Yeah, I know, yeah.
And then one other thing I wanted to add, we have problems giving her medications. And we found this pharmacist, it's in Fraser,
You
and
said
it's called
compound
RX,
this.
Mhm.
RX Remedy.
Those are phenomenal.
who will, you know, mix her medication.
Flavor it,
she's-
yep.
Yep.
Yeah, and so that's
Gateway
the
in town
working.
does some too.
Oh, does it?
That's good.
we found liverwurst.
Liverwurst works.
I wrap pills and liverwurst, and they absolutely love it.
Trader
Yeah.
Joe's has a bacon flavored
Yeah.
bacon liverwurst that.
Yeah.
You're talking about diets.
Mhm.
A year and a half ago, she stopped all dog food, so we went to rotisserie chicken, we're now
Oh, yeah.
on liver.
Oh, yeah, I got one, I got one. She's
Well,
past
yeah.
the rotisserie, she's on to
Yeah.
beef from the farmer's market.
Was that for the diets, because I know the normal dog foods have the enhancements and the vitamins and
Yeah.
all, we tried to give her supplements, but. no.
So the best thing if you're gonna do it, I'm not opposed to it. In fact, I think the best diet any of us could eat is a home cooked, balanced, organic diet. So, but it's really hard to do that for us, and it's very hard to do that. So if we're feeding long-term, home cooked diets,
Mhm.
then I usually will recommend have a vet nutritionist. These are veterinarians that have gone beyond veterinary school that are board in nutritional medicine, and they can very easily balance out a diet for you with the minerals, and they can fine tune it if it's got kidney disease or it's got liver disease or we wanted to lose weight. We can, so, and your vet can get you in touch with it. They're at,
Weight-wise, she's good, she's
Yeah.
41.
so you just would want a maintenance diet that, is gonna be more balanced than, like what my dog is eating right now. so.
Pure protein, that's all she eats.
Yeah.
A kale shake in the morning.
Yeah, there you
Yeah, a little pasta, some of the carbohydrate, because they do need the fats, and the carbohydrate, they do need that ratio. Dogs are like us, they're omnivorous carnivores, so we're kind of designed to eat a variety of things, unlike cats who are obviously protein eaters.
Yeah, that's the surprising thing with this dog, she has always, since we've had her, she's a rescue, has been very finicky where, her brother has a side also, and you put anything in front of that dog and it's gone.
Yeah.
And it's one to look and just walk away.
Yeah, I know.
Have you seen that with the kids? I mean, it's the same
Yeah,
thing, you could have
yeah.
twins and they're
Right.
Sides
so
are like that.
opposite.
We have some that are voracious
Mhm.
eaters, and I have others. Yeah, take it or leave
They
it.
take a special owner. They're a generation breed, I'll tell you. You have-
We have 7. Well, I had 7. We're down to 6 now.
Yeah,
Mm.
they are.
They're interesting, yeah. It's funny, we also had a cat, and the dog knew the pecking order in the house. It was me, the cat, the dog, then Linda. That dog could walk all over her. And
Yeah.
that 40-some pound husky was afraid of that 10-pound Maine Coon.
Oh, yeah.
Literally afraid of that
Yeah.
cat.
Yeah, it's all about attitude, not so
Yeah.
much the size.
Yeah, that cat was standing up to the dog.
And they train us so well.
Oh,
Yes,
yeah.
no,
They
absolutely.
really do.
Yeah, we don't stand a chance.
Yeah.
And I have one 15-year-old had a litter, and she was whelping in the basement, and every morning I would get up and cook her a hamburger, brown rice, and eggs. And then she would just get a regular kibble when she was nursing. She was nursing 7 pups. She'd come up out of the basement from the whelping pit and sit there, wait for me to cook her breakfast. Neatest thing was the puppies got about, I guess, 5-6 weeks old. She ate like half of the hamburger, and she ate the rest of her rice, and she took the hamburger down. I followed her. I gotta see this.
Yeah.
She set it in the whelping bin, and she's nuzzling them over. And I'm like, I don't, just the instinct of getting them on the. Good, cool. I only had one litter. It was I couldn't. When we sold them, I had to stay at work because I was like, I don't want to sell. And I would have kept all 7 of them.
Yeah, there's an interesting book called The Inside of a Dog, and it's by a researcher named Deborah Horowitz, and she goes through all the different scent of the dog, the eyes, the ears. She spends a lot of time on the sense of smell because that's really where they're wired, and it will blow your mind. Like, you always know dogs smell well, but it's amazing. I think she's since written one just about the smell, but
What's it called?
It's, the one is called The Inside of a Dog. It's like a
I'm looking for
interesting-
something new to read
Yeah, and Deborah Horowitz.
currently.
And she does have another one out, I think just on the sense of smell, but I haven't read that one.
And have you ever, used animal communication to see what was going on with animals and everything?
I did, you know, a friend of mine had a cat that they were like, this lady's amazing, she's amazing, and she, the one cat was kind of heavy, and I don't think the woman knew this, she was doing this over the phone, and she, Mookie or something, I think was his name, and she told them that Mookie was comfortable with its body image, and that it hated the cat outside, and that was something else she didn't tell them, that there was this cat that would show up in the neighborhood, and this cat would just go ballistic every time it saw it. So I don't know, you know, I'm open to whatever.
Yeah.
I believe it, but she talked to one when we were looking for the dog, and one dog, she had the radio on out in the kennel, and she said, well, he doesn't like the radio on.
Yeah, and the woman had no
How would she know? She was in Florida.
Yeah.
Yeah, she said, what's up with the radio in the dog kennel? He doesn't like the music.
Yeah, I know.
Sorry to cut things off, but we're
Okay.
closing in a
Yeah.
few minutes.
Yeah.
Thank you.
Thanks again, everybody.